Welcome back to Yahoo Finance Live. President Biden is losing Americans' trust when it comes to providing accurate information about the COVID-19 pandemic. That's the finding of a new Axios Ipsos poll. Joining us now is Dr. Ali Raja, professor at Harvard Medical School. We're also joined by Yahoo Finance's Karina Mitchell. Dr. Raja, always good to have you here on the show. I want to start with that Axios poll because that same poll found that more Americans now expect it's going to take at least another year or more for them to return to their quote unquote normal lives. Do you think that that's a fair timeline?
I do. The tricky thing is we all expected variants, but there was really no way to predict something as transmissible as the Delta variant has been found to be. And unfortunately, the pandemic just isn't something that's going to come to a quick or hard and fast close. In fact, I was talking to a couple of the nurses I work with just yesterday when we were both in the emergency department, and we talked about the fact that some of us might actually wear masks much longer term, especially at work, since we haven't been seeing all the colds that usually result in a bunch of call-outs because everybody's been wearing masks and protecting themselves. So I do see this as going longer than I think many of us would hope.
And Dr. Raja, let me ask you, how effective do you think these mandates really are? We've just seen Governor Abbott in Texas say that, executive order that you don't have to wear a mask, you don't have to get a vaccine unless you want to do so voluntarily. It's already thrown so many businesses in the state into a tizzy. It's home to so many multinational Fortune 500 companies like Dell, AT&T, Cisco, Oracle. Southwest just said that they will not follow that state mandate. They will follow federal orders. So doesn't it sort of create this sort of chaos? What do you think Governor Abbott's mandate will do, both in the state and more widely?
It's a really great question. Here's the thing. I'm from Texas, and I love so many things about the state and the people, but pushing back on the ability for businesses to have a COVID mandate is just a really bad idea. We know that vaccines are safe and effective, and that for a lot of businesses that deal with large segments of the public, think the travel industry, think hospitals like the one that I work in, we need the people who are using those services to feel and truly be safe. For example, the Texas Medical Center is a huge healthcare metropolis. And think of all the immunocompromised people and the young children who come for care there. They really need everybody caring for them to be vaccinated, and not allowing a vaccine mandate like this for certain businesses really leads to confusion and a lack of safety.
I want to turn our attention to Halloween, fast approaching, and lots of kids want to get dressed up and go trick-or-treating this year, something they didn't do last year. Dr. FAUCI came out and said, last year it was a different situation. Trick-or-treating was considered a high-risk activity. He's actually advocating kids go out and trick-or-treat this year, stressing that, it's mostly an outdoor activity. What's your feeling on that, and how would you advise young ones this Halloween?
I've got two kids. They're 7 and 9. They've got their costumes picked out. My wife and I have our costumes picked out to go with them door to door. I'm really excited about it, and I hope that other people are as well. As Dr. FAUCI said, it's an outdoor activity. I wouldn't send younger or unvaccinated kids into people's houses for like haunted houses or anything without wearing masks. But if you're going to be outdoors running from house to house, this is a great return to normalcy that we can give our children based on the way that our society is doing in terms of working on getting the majority of people vaccinated. I think it's a great idea to do it.
Doctor, let me ask you really quickly. Do you believe that there is a weariness that might set in the longer this drags out? People follow, vaccine mandates, protocols, show a vaccination card when they want to go to a restaurant or a museum or a gym. Do you think at some point there's a tipping point and people just get fed up and say they don't want to do this anymore? I know a lot of people already saying getting a third jab, in the space of a year is a bit too much for them. What's your feeling on that?
Obviously, the response is going to be widely varied across an entire spectrum, right? We have some people who are advocating for and sneaking in extra shots of the various vaccines, even when they're not supposed to, or going earlier than they should. We've got people who obviously don't want the first vaccinations, much less the second or potentially a third vaccination. So everybody's going to have a very different view of that. I think that what gets to people, what demoralizes and confuses people, is when there is constantly changing recommendations. And when you think about it, unfortunately, right now, we're making policy as evidence comes out. So it's inherent in the process that things are going to change. But once we know more than we do now, and we're able to get to a steady state in terms of what we need to do to keep us safe, I think people will eventually come to expect it. Think of all the things that went into TSA screening after 9/11. Now we're just used to doing that as the standard course of air travel. I feel like once we know much more than we do now, we'll be able to get to a steady state, and that confusion won't make people as demoralized as they are.
Doctor, real quickly, there was this article by a Brown University economist, Emily Oster, recently, and in that article, she was criticized for it. She said an unvaccinated child is at less risk of serious COVID illness than a vaccinated 70-year-old. We know that COVID is a threat to children, but is it such an extraordinary threat that these young kids should be getting vaccinated? And are you going to be vaccinating your own children?
So briefly, just two quick things. Number one, that article, the data is actually accurate. And what she said was right, that a vaccinated 60 or 70-year-old has about the same risk of hospitalization as an unvaccinated young kid. But that's serious illness and hospitalization. We all know, as the parent of two young children, we all know that young kids don't do all the other things that vaccinated 60-year-olds do well: wearing masks, distancing indoors, washing their hands. So the risk of transmission is higher. So especially as we talk about going into the holiday season with Thanksgiving and Christmas and young kids being around potentially immunocompromised adults, we need to be safe. And I'm definitely going to be vaccinating our kids, my wife and I, if the FDA and the CDC approve them.
All right, Dr. Ali Raja, professor at Harvard Medical School. Enjoy trick-or-treating with the kids, and thanks for coming on the show.